Hi, everyone. Thanks so much for joining. We will get started very shortly. We're just waiting for some more attendees to come in. Um, but yes, we have a very packed agenda today, so we will try to get started on time. And if you're able to, and if you want to, you can use the chat feature to introduce yourselves. I'm not sure if that's enabled from the attendee side, but if you can, would love to just see where folks are coming from. And then we'll try to leave about 5 to 10 minutes at the end for a Q&A. But we have a really, really great lineup of speakers beyond myself that are here to share more about our project, but also what we've learned and next steps for this as well. But yeah, so I'll go ahead and get started, I think, just because I want to be mindful of everyone's time. But thank you so much for joining. My name is Sneha, and I'm the executive director at Generation Patient. And I'll share a bit more about Generation Patient in a minute, but really wanted to, first of all, thank the Lucile Packard Foundation for Children's Health for their support of this project that we've done over about a year, year and a half now, where we've really sought to amplify and place young adult patients at the forefront of health systems change. And we've done this through a variety of different pathways. And you'll get to hear a little bit more near the end of the webinar as far as how we've done so. So, for those of you who don't know Generation Patient, we represent young adults between the ages of about 18 to 35 with different chronic conditions from lupus, arthritis, Crohn's, hemophilia, sickle cell, a wide range of conditions. And we've approximated through data from the CDC in 2019 that there are about 25 million young adults with chronic conditions in the United States alone. So it is quite a large demographic. And historically, we've sort of been placed either with pediatrics and adolescents or with adults and older adults. So at Generation Patient, we're really focused on the 18 to 35 demographic. And we have some people a little bit younger and a little bit older that join and participate in our programming. But we are led by young adult patients, some of which you'll get to meet during the webinar today. And our roundtables are really meant to, again, bring young adult patients at the forefront of health policy and research. And joining me is Peyton to provide some opening remarks as to why this is important. And by way of introduction, Peyton has been an advocate with us for probably the last 3 or 4 years now, with leading some of our peer support meetings. Peyton was our health policy lab co-chair last year and has just done instrumental work with us at Generation Patient. So I will turn it over to you, Peyton, to provide some opening remarks before we dive into the Roundtable Series.
Thank you so much, Neha, and thank you for the opportunity to be here and to speak with you all. So, as Neha said, my name is Peyton Miles. I use she, her pronoun, and I'm a young adult patient. Um, and I really think that people with firsthand experience have the knowledge to create the most meaningful change. As a young adult patient myself, I've realized a lot of the systemic issues that we face, they stem from the fact that people who don't have a deep understanding of the issues are the ones who are creating changes. And these roundtable conversations have really opened up the chains of communication to improve our system for the better, by having young adults at the forefront of the conversation and at the forefront of the research. So I also think a huge part of it is that as young adult patients, we have a very unique perspective, because we're exposed to the challenges and complications that are within the system. So we not only have the incentive to change the system for other patients, but we also have the incentive to change the system, to better our own futures. Many people don't understand the issues within our medical system until themselves or a family member goes through it. And as we have to face these things in our young adult lives, we have the necessary and firsthand knowledge and experience to reduce barriers of care and to improve the experiences that a lot of patients face. Systemic change led by young adult patients not only benefits all patients, but it also provides meaning to our experiences. For myself, I know that I had to change direction after high school, and finding meaning beyond chronic pain and disability was a real challenge for me. But I realized that sharing my experience has the power to not only educate others, but also to inform and drive change. This was incredibly meaningful to me. Through my role as health policy lab co-chair, but also with the research during the roundtables. So I'm just really grateful for the opportunity to share my experience.
Awesome. Thank you so much, Peyton. And you'll get to the opportunity to ask questions to Peyton moving forward as well. So I'm going to go into what the roundtables are. So the roundtables are essentially mechanisms that we use to amplify and center the experiences of young adult patients in systems change. So we know that there has been a huge movement inspired a lot by the long COVID movement to have patients not just included within research or not just included within conversations about systems change, but actually driving that. And Peyton kind of alluded to that in her remarks. But that is something that we are very much aligned with at Generation Patient and believe that young adult patients should be driving what the research questions look like, where the systems need to be changed. And so we've taken this roundtable model where we have about 2 hours for one particular topic, which is not enough, and I'll go into some of the topics later. But we have about 30 minutes where we have a young adult patient and a healthcare professional, whether that's a clinician, social worker, a health policy professional, someone who has a bit more professional expertise with the topic, coupled with lived experience. And they present for about 30 minutes, and then we have about 60 to 90 minutes of a facilitated discussion with about 20 different participants. And this can include clinicians, policymakers, uh, parents, young adult patients, of course, and other advocacy groups. And from these, we identify one, some of the key challenges, but also the key opportunities that exist for systems change for young adult patients. And what is really exciting, and you'll get to hear from Catherine and Rose a little bit later, is that each of our roundtable discussions results in a peer-reviewed publication. And that peer-reviewed publication is led by a young adult patient as the first author, where our demographic and our community is given the tools and the training to be able to capture some of the insights of their experiences, but also the roundtable discussion into an authored publication. And so we're anticipating about 7 peer-reviewed publications from this roundtable series, 2 of which have already been published, and 5 of which are either undergoing review or are going to be published soon. So, how we kind of came to what systems change should look like with this project was through developing a medical advisory board where we had about 5 individuals who, again, came from a social work background, who were med peds physicians, and just people from around the US that sort of had an expertise in the clinical side of working with young adult patients. And then we had our patient advisory board, which were 5 community members from the Generation Patient ecosystem who came together and identified the topics for the roundtable series. So as you can see, these topics are very vastly different, but all of them are very timely to some of the conversations and concerns that our community is bringing up. So we've had conversations on the usage of AI in healthcare and in mental health for our community. We've talked about medical trauma and addressing mental health in the care of our community, peer support interventions, forced poverty, and income volatility. So these were all themes that we compiled from both our medical advisory board and our patient advisory board, which met for about 5 to 7 different meetings, and we narrowed our topics that way. So I'm going to run through each of the roundtable themes very, very briefly. And just so you know, on our website under roundtables, we have recordings of the presentation components of these roundtables. So you can kind of check out a little bit more background of the framing of some of the system's challenges. We don't publish the discussion portion just to keep the participants anonymized for our publications, but I'll run through just some of the key highlights and themes that our community and partners have brought up through these discussions. And I'm going to keep this kind of quick because I think that the best part of this webinar is going to come from Catherine and Rose's discussion on patients authoring publications and involving our community in that process. But our first roundtable topic was on transitioning from pediatric to adult care. So this is a huge area that has been pretty well studied of the challenges of young adult patients transitioning and transferring into adult care. And I think some of the key themes that came out of this publication, which has been published to the right, so you can sort of check that out on your own, was the importance of training adolescents early on to start to become more familiar with key components of their care. So whether that looks like, asking about what medications they're taking or asking about how much they know about their condition. These are all themes that came up from the roundtable as critical so that when a young adult patient is in adult care, they aren't forced to learn all of this information on their own for the first time. We also noticed that there were a lot of adult providers who, not only with this roundtable, but just in our conversations, that had a little bit more hesitancy with working with young adult patients. So we noticed the Peds side maybe had more tools and was well equipped in general to work with young adult patients, but when they went across the pond to the adult centers, that's where there was a bit more hesitancy for engaging and working with young adult patients. And lastly, we really found the importance of nurse transition coordinators, which could really help bridge some of the communication gaps or serve as a source of support that was not the clinician as key. And some of the themes that we brought up was, could there be a cost effectiveness study done of nurse transition coordinators or sort of a longitudinal study done on the value of nurse transition coordinators for young adult patients who are entering adult care? So our second roundtable was focused on medical trauma and mental health. So medical trauma is a conversation and something that we've heard very consistently from so many of our peer support meetings as a barrier to care and a barrier to accessing care. And I think being able to name this just upfront is huge because we know that so many of our community members have been sick since childhood, for example, and have gone through pretty intense medical procedures and interactions with the healthcare system, and just the anxiety that can come with that and the challenges that can come with feeling confident and being in a clinician's office or having a medical procedure can be huge. And so this is kind of obvious, but I think it's important to say the importance of integrating mental health care into the standard of care for young adult patients, making sure medical education is trauma informed, but also if there is a potential for a follow-up study on quantifying the financial impact of medical and micro traumas, because we know that this is something that socially, emotionally is incredibly challenging, but how can we sort of quantify that economically so we can continue to make the case for this to be addressed and centered within the care for young adult patients? Okay, I'm going to go a little bit quicker so we can get to the discussion portion. But another roundtable topic that we had was on ableism and ageism. And ageism is something that's very, I would say, in many ways unique to the young adult patient community because when we're going to adult providers for the first time, it can feel really intimidating and just very difficult to feel like we're being taken seriously. And we have a number of anecdotes that came out from the publication that really highlighted the challenges of being 22 and seeing an adult provider for the first time. And so we kind of came up with what are some main like solutions for ageism within the healthcare system. We recommended that clinicians can adopt what's called uncertainty scripts, which I'm happy to go into, but which is also in the publication. Having healthcare navigators, so again, pointing to nurse transition coordinators, which can be a key component of making sure that the needs of young adult patients are well addressed, and can sort of be a bridge to the potential power imbalance that exists with adult providers and young adult patients. Um, eh, Pathways for young adult patients to continuously inform healthcare systems. So, what does it look like for young adult patients to be on advisory councils or embedded within the clinician's office to provide feedback and to provide education and information on the young adult patient experience separate from adults and older adults? And I think one thing that is so critical to understand about this whole roundtable series is that some of these things seem like they're nice to haves, not essential. But when you look at the outcomes and when you look at the possibility that exists for young adult patients to be able to receive adequate care, to be able to follow up on their care, we really believe that it can improve disease outcomes, it can improve identity, and truly the ability for our community to thrive into adulthood. And so all of these are components that we see as crucial to address and to sort of remedy in various ways so that we can improve disease outcomes and that we can improve disease acceptance and management for young people entering adulthood with lifelong conditions. And we have a variety of other recommendations that came from that roundtable, but I just pulled this quote that one participant in their late 20s mentioned I could easily pass as 18 or 19, and the way I present myself in the clinic has a big impact on how I'm treated. So we know that, age compounded with a lot of different other stereotypes makes it sort of a perfect storm to receive and have uptake in care. And I just want to share this quote because I also think it goes to show that we've heard examples of our community members who are dressing differently for doctor's appointments or presenting themselves in very different ways, trying to seem more sophisticated or more articulate, which is really, not the way that we want patients in general to have to feel like they're interacting with their care. So another component is a huge roundtable is peer support. And peer support, if you are aware of Generation Patient, is very much the bedrock of our work. So this roundtable was really special because we believe in peer support as an intervention rather than just a nice to have service. We've led over 650 peer support meetings at this point, so we have quite a large knowledge base. But what this peer support roundtable did was really formalize some of the recommendations that we have for researchers and for the ecosystem to start to fund more peer support. So, one of the main outcomes that came out was the need for truly peer-led support. We've noticed that there's a lot of provider-led support, a lot of peer support that support spaces that happen in institutions. And while those all might be great options, we see just a greater need for peer-to-peer support. So young adult patients facilitating peer support meetings and really leading those spaces. We also know that funding is very limited for peer support, so thinking more creatively about reimbursement models or figuring out how we can maintain peer-to-peer support, but integrate it within institutions that could allow young adult patients to really lead these spaces for sustainability. And then peer support is not a one size fits all. It was very clear. We know that across the disease journey, particularly for young people who are coming into their identity with a chronic condition, sort of understanding what peer support might be beneficial to them based off their life stage, their developmental stage, but also their disease journey. And lastly, something that I didn't include, but that was a part of this roundtable was, again, can we think about what a cost effectiveness, what a comparative effectiveness study looks like so that we can show the value of peer support economically, again, to think about how do we increase awareness and uptake of peer support at a systems level. And a lot of that we know comes down to the ability to fund and sustain these spaces. And we have a ton of resources on our peer support page on Generation Patient website as well. So, financial instability, we came to this topic just due to a lot of challenges with Medicaid, a lot of the conversations that we're seeing surrounding, previously the repeal of the ACA, which has been essential for our community as young adult patients, many of which turn 27 every year and are sort of forced to be off their parents' insurance if that was an option in the first place. So this roundtable really focused on some of the more timely issues that were happening in the health policy space. So we discussed the affordability of therapeutics, of prescription medications. We discussed Medicaid and HR1, but we also integrated practical recommendations for our community to be integrated into these conversations. There's a lot of challenges with the medical frailty exemption, thinking about how oftentimes young people are not seen to be sick, or not seen to be unable to work, but that is the case for so many of our community members who are taking a break from school, a break from work. And so it's really essential that our demographic is captured within conversations about Medicaid implementation, about work requirements. And so one of the recommendations that came, this roundtable publication has not been published yet, but is to make sure that our community is part of the statewide beneficiary advisory councils. We have a number of recommendations that really point to how to include our community within the current conversations about Medicaid as well. So another roundtable was focused on clinical trials. So this is an area of work that's very, I'd say, novel in many ways because there has not been a lot of conversation on young adults in trials. And I also understand we're going through a lot of different topics, and part of the roundtable was to be able to really pick and choose different topics that have been underaddressed as it pertains to the intersection of young adults and chronic conditions. So one of those topics was clinical trials. So we know that a lot of trials have, or a lot of research spaces have called out pediatrics, adolescents, adults, and older adults, but have not really identified young adults. So certain trials, particularly for autoimmune conditions, autoinflammatory conditions, group young adults as 18 to 64. And for us, that is concerning for a variety of reasons, least of which we know that the body of a 20-year-old is very different than that of a 60-year-old, but also just going on to how do we think about enrollment and making sure that our community knows what clinical trials are, how to access them, considers all the different variables that young adults are often very mobile, or are moving state to state, have various factors like education, employment, things that they're dealing with for the first time. We are dealing with the first time. I'm also a young adult patient. Um, and I think it's really, really critical for us to think about the clinical trial ecosystem and disaggregate even between the 18 to 29 demographic, for example. And what's really exciting about this roundtable is a lot of the conversations from this are being used to inform some of our legislative priorities moving into this year regarding young adult representation, engagement, and disaggregation in clinical trials. So each of these roundtables is very much informing the work that we do and the work that we are about to do, which is very, very exciting because it's great to have a peer-reviewed publication out there, and there's so many reasons why that can bring legitimacy to young adult patients. But until we can actually move some of these recommendations and insights into action is where we see the most excitement and are really eager to do that post these roundtable series. Our last roundtable series topic was on AI and healthcare. So we really grouped this conversation, this discussion into two categories. So one, AI for mental health, and two, AI for healthcare or within the clinical setting. And we saw challenges and opportunities with both. So, for example, with AI in health, we were really excited about the opportunity for some of these tools, knowing that there's a lot of challenges that come with the legitimacy, but also the accuracy of these tools, but ways that young adult patients can learn more about insurance or their healthcare through some of these tools. On the flip side, we also acknowledge that a lot of these tools are not made or designed with the priorities of young adult patients in mind. The language could be off. The various biases could be very pervasive within these tools, as we've heard from the experiences of our community. So we see the promise and also the importance of engagement of our community in the design of these tools, especially if they're centered on healthcare. And then on the mental health side, we discussed the challenges with AI chatbots, given that there's one study, for example, that shows that young adults with chronic conditions are 363% more likely to attempt suicide and have very high rates of loneliness, depression, anxiety. And so the usage of these tools we've noticed within our community as forms of emotional or social support. And the regulation is not caught up whatsoever for these tools. So thinking through how can we as an organization play a role in making sure that these tools are adequately overseen and are giving the right guidance to our community. And so this is an area that's very nascent for us, but an issue that has directly informed actually another project that we just received support for, focused on increasing oversight of AI companion tools as medical devices at the FDA. So this roundtable publication summary, even though it has not been published yet, is directly informing our next project, which we just started a couple weeks ago, which is very, very exciting. And the insights from these roundtables are really grounded in the experiences, first and foremost, of young adult patients, which is essential. So I'm going to pass it on over to Catherine, who's going to share a little bit more about her experience leading our publications and leading the publication and authorship process for young adult patients. So, Catherine, I will turn it over to you now.
Great. Thanks so much, Sneha. I really appreciate it. And it is such an honor to be able to present some of the work that we have done in having young adults be first authors and lead the writing process for these roundtable proceedings documents. So I wanted to take just a couple of minutes to talk about the writing process as well as some of the things that I have learned throughout this process. And then Rose and I will, who is one of our young adult patient authors, we will have a chance to have a conversation and a dialogue about this process so that you can hear a little bit more about the experience from both of our perspectives. So, just a little bit about me. I am a young adult patient, but I am also a nurse scientist. So, I have my PhD in health services research, and my area of research focuses on the young adult patient experience. So, my role here is sort of in that bridge role between the patient and the sort of academic community. So, with that in mind, my role for Generation Patient was to really support the writing process for our young adult patient lead authors. So, just as a brief overview of the process that we used, for those of you who may be interested in doing something like this at your organization, we first identified the young adult patient co-author, and with the way the roundtables worked, that was usually the young adult patient that was co-presenting the topic prior to the roundtable discussion. So that's usually who that person was. So they were kind of pre-selected and they agreed to be a part of this. And we did compensate the young adults for this, which I think is really important. Following the roundtable and honestly during the roundtable, we developed an outline of the key points, which was then used to guide the first meeting. So within 1 week of the roundtable, we would convene the first meeting with myself, the young adult patient lead author, as well as support staff from Generation Patient. And during this first meeting, this is where we laid the foundation for the writing process. So first we had introductions, and then through just a general casual conversation, I would assess the level of scientific writing comfort and experience of the young adult patient author. with kind of an introduction that maybe this is different than the kind of writing you've done before. Maybe it's similar. And we had such a wonderful variety of experiences of the young adult patient authors coming in. And I'll talk a little bit about that in sort of my lessons learned. But the whole goal of this conversation was to tailor the writing support to their level of experience and level of comfort. So, knowing where they were at and meeting them where they were at, we would then do an overview of the scientific writing process, talk a little bit about the publication life cycle so that they would know kind of what would happen from the very first meeting all the way up to when we got our proofs from the journal. Then the method that I like to use for writing is to identify three main points. Sometimes it was three, sometimes it was five, but it was the concept of kind of getting those key so what's or key takeaways from that outline of the main points of the roundtable. And then once we kind of had a game plan of the flow of the proceedings document based on that outline, we would then develop a writing plan and set weekly goals, which was, I think, really, really important to have this timeline and these goals set so that, again, we would offer flexibility, but to really try to have those benchmarks along the way. So it wasn't just, okay, I'll see you in a month, send me a draft when it's done. It was, okay, let's work on this paragraph over this week. And then we'll check in either via Google Docs comments, via email, or via an in-person Zoom or in-person live Zoom call. Everything was done virtually, which made this really accessible. And then when the draft was complete, we actually identified the target journal at the end to really allow the young adult patient to kind of write what they needed to write without those constraints of a particular journal format. I think I'm not saying that that's the right way to do this, but that's what worked for us. And then we identified the target journal and then we're able to edit things down as needed or tailor it to the journal as needed. And for some of these proceedings, we also had a senior author who was a clinical or industry expert to offer that their expertise as well. However, the young adult was still the first author, and they led the writing, and it was just the expert coming at the end to help with some of that editing and that feedback. So the most important takeaway here is that our young adult patient authors are always the first author. Oftentimes, it's their first author experience, which I think is so important, and one of the most exciting things to me about this process that we have. So we can forward to the next slide. So I just want to talk a little bit about the lessons that I learned for this being my first time doing this in sort of the mentoring or coaching role here. And then we'll talk a lot more about this when Rose and I have our conversation next. But just as a little bit of an introduction, the most important thing I found is that instilling confidence in the young adult patient author I found to be the most important foundational step. And I think one of the things that I saw again and again was kind of this idea of, well, I don't have XYZ letters after my name. So why is my perspective important, or it's not as important as someone who has a PhD or someone who has an MD, and really instilling that confidence of the lived experience that you have is actually essential to this. And we really do want to leverage that lived experience because that's what makes these proceedings unique. And I think that's what's missing from a lot of our body of scientific literature is the lived experience, is the patient experience. So really trying to instill that confidence that, maybe you've never done this before, but you're bringing something that we don't have. You're bringing something really unique and special, and making that sort of elevated and important, and saying maybe you've never published in a journal before. That's okay. We'll fill those gaps in for you. You're bringing your lived experience. We can't create that without you. We'll fill in everything else in terms of the technical piece of the scientific writing. And that goes along with the theme of being open to and learning from each other. I might have the skills that I've gained in my doctoral work and my career in how to write a proceedings document or how to do a scientific paper. But the young adult patient author brings something unique from their lived experience. And together, we're going to learn from each other and we're going to create something really special that we wouldn't have with just one or just the other. Um, and then finally, in working with young adult patient authors, the flexibility and the adaptability are really important. So having a rigid system isn't going to work. And the process that I outlined on the previous slide looked a little bit different for every patient author because everyone is different. Sometimes we maybe had a scheduled meeting, but energy or health or something like that just wasn't quite there. So we pivoted to communicating in Google Doc comments and just really being adaptable and flexible were really important. So not having a rigid plan, but just kind of going with the flow and meeting each other where we were at, having goals, but also having flexibility within those goals, I think helped us be really successful. So that's all that I have as sort of a little introduction here. Great. So I think we are going to chat now. So I have Rose Color here, and we're going to have a little bit of a dialogue about our experience working together. So Rose and I work together on the clinical trials proceedings document. And Rose, would you like to introduce yourself? And then we have some questions for each other, and we're just going to talk about our experience.
Absolutely. It's so exciting to be here today with you and with everyone watching. My name is Rose. I am a cystic fibrosis patient. I'm 24 years old. And though I have a college degree, it was in English and government. And I currently my day job is in state government. And so I cannot stress enough the extent to which I'm not a member of the Scientific Academy in any way, shape, or form, really. And so going into this process, I really was sort of case zero, patient zero of the type of person who, because she didn't have all those right letters after her name, thought to herself that this might be a little more than I can chew. But thanks to Catherine and thanks to Generation Patient, I was walked through the process and through that process really came to appreciate the extent to which my life experiences as a young adult patient were actually the credentials that we need to be talking about these things. For years, I have had advocacy experience with my National Patient Advocate Association and with other smaller groups. And so I was accustomed to being part of some of these conversations via being a member of a patient oversight committee or a patient advisory committee. And I was so used to that paradigm of that being what counts as patient-centered, right? That you are on the outside looking in to a process. And what I really loved about this was that in the roundtable framework, that it really flipped that on its head in that we started coming at it from a lens of what if it really started, what if it began and ended with the young adult patient themselves? And so I learned a lot through that process, and I'm still learning as the process is wrapping up. And I had so much fun during it, and I just love to talk about it. So I can't wait.
Awesome. Yeah, thank you so much for that introduction. So I'll give you your first question, which is, what was your, in general, what was your experience like doing this and, being a patient author for the first time?
Definitely. So I had some prior experience writing things of the English major variety that in no way, shape, or form ever encroached on the peer-reviewed scientific realm at all. And so that made it a little intimidating because I, for a variety of reasons that were, quite frankly, related to my health, stayed away from pursuing a STEM education and pursuing that kind of rigor because I thought it wouldn't really be accessible to me. You know, my health can be unpredictable. At times I, at the drop of a hat, need to go into the hospital, need to go to doctor's appointments. I'm not up for a particular task on a given day. And so when I began writing this project, when I began writing in this process, it was a little nerve-wracking to be embarking on something that hopefully at the end would be published, not just on some Substack blog somewhere, but like actually verifiably published with my name on it and with other professionals with credentials names on it. And so at the outset, I was a little nervous, but because the process was so flexible, like Catherine mentioned earlier, there was an instance where I we had a scheduled meeting, and for a variety of reasons, I wasn't able to meet that meeting anymore. We were able to pivot and instead meet and use Google Comments on the Google Doc to work through our comments for that day. And so for me in particular, my system worked where it was mostly hands off in that we checked in virtually. Importantly, having one check-in once a week so that I could work on a section at a time. And unlike all of the other writing work I'd ever done before, it didn't feel like a lonely endeavor, really. I was so used to starting with this like blank page and, being given a sort of gargantuan assignment of, you need to have an 8-page paper written on this and such a subject. But here, because I had given a presentation on the subject and because I had already attended the roundtable, all of the thoughts were already at the top of my mind. And also I had the transcript of the Zoom itself and we had discussed an outline. And so it really felt like I could get off running, basically. It was never um even though it felt like a big task at the outset, it already felt like I had begun some of that work. And that was really incredibly helpful as well. Um, and the only other thing I'll add is that it was incredibly important for me and in my situation, and I think probably in other patient situations too, that this work was compensated. I did not have to make the judgment call of whether or not I should give up some of my other part-time work to make time for this work, which would be free because it was compensated, thanks to a grant that the Generation Patient secured through the Lucile Packard Foundation. So that was really incredible. I know young people, affordability and young people are a conversation nationally, of course, but I would wager that for young adults with chronic conditions, it's even more of a consideration. And it was just incredible to be able to be part of this process that accounted for that.
Yeah, absolutely. And I think the compensation piece is something that I don't know. I think Generation Patient is on the forefront of that, because I think hopefully this is something that's changing, but I think there's this kind of precedent that the patient perspective is free, and
Yeah,
it shouldn't be. It shouldn't be. We should
absolutely.
compensate that experience for the very valuable thing that it is.
Totally.
Yeah. So I'll throw one more question at you, Rose, and then maybe we can see what's on your list. So what does authorship mean to you? So you're going to have your name as first author on this when it's published. What does that mean to you? Like, what does that feel like?
Yeah, it's really kind of surreal in that um for a while I had kind of resigned myself to this reality that being part of advocacy efforts within the scientific community, we're always going to be putting forward other people's work and championing other people's reports and championing um, these big ideas and papers with really prestigious institutions producing them and I was okay with that, and it was sort of a reality that I'd resigned myself to. Um, and so when I was approached to do this, it was part of that reckoning of like, me. Like I'm someone that could actually like write something, not only write something, but not write something and have my own name attached to it and have that be enough, was really incredible. Because again, for a long time, for a variety of reasons, there are a lot of situations in which I'm not enough, right? Like I don't have the lung function of a regular person. I was not able to go through the education system without an IEP. Like there were so many moments where it was so clear to me that by virtue of my chronic condition, I just I wasn't enough. And so to to be able to be able not only to be part of something like this, but to actually be an author and to be first author, um, was very personally gratifying. Not only because obviously for me personally, it feels like an achievement, but also for what it stands for, which is that actually patients do deserve to be in this position. It's for too long, I feel like we have been excluded from being the true center of these conversations. Everybody loves to talk about patient-centered this and, family guided that. But I humbly submit that on occasion, that is sometimes a bluff. Not a bluff, but sometimes an overstatement. And here in Generation Patient and with this roundtable framework, it is most decidedly not. And it's an honor and a privilege to be an author, and I really look forward to reading other patient authors. It's just so exciting and gives me so much hope for the future. And I know that I only have a window into my lived experience, so I'd really be curious, Catherine, from your perspective, like how how did this process change from author to author? And what I know we talked about flexibility on my end a lot, and I got to experience it myself, but I'd be curious what it looked like from your perspective.
Yeah, absolutely. I think from my perspective, it was really sort of going into it with an idea, with a little bit of structure, because you don't want to just go in and say, okay, let's do whatever. But there was this idea of sort of really being open and listening to where the my co-author was going to be coming from. And I think that first meeting was so important to just say, okay, like, what are your motivations for being here? What's your experience? What makes this exciting to you? And then trying to tap into that. Like, why are you here? Why are you, most of these people had a full-time job or a part-time job or were in school. Why do you want to spend like your evenings on a Zoom with me talking about writing? Or why do you want to be on your Saturday deep in a Google Doc or doing research on PubMed? Like what drives you to do that? And then using that to sort of tailor the experience to what made it exciting. So for some people, it was sharing their own personal story. Or for other people, it was maybe creating something that was going to create policy change in the future. So I think that for me, that flexibility was really coming from listening to my co-authors and figuring out their motivation and their needs too, of like what do you need to be successful in this, knowing that it's not going to be the same for everyone. So some people really wanted an outline and wanted to do from blank page to bullets to sentences to paper. And other people were like, actually, I kind of love a blank page. Let me just sort of word dump on it and then we'll refine after. And be like, both of those work. It's whatever works for you. So just, I guess, being really open-minded was the core tenet for me. And trying to not be like, well, this works for me, so it's going to work for you. Just being like, well, these are some options. What do you think is going to be best for you?
That's so cool. Especially cool because I hear some of those strategies and think to myself, yikes, that sounds like a personal nightmare for me, but I'm so glad that it worked for other people. Um, Incredible. The human experience, so vast, so interesting. Um, I guess related to that line of questioning, I'd be really curious from your perspective, what makes a successful patient author?
Oh, that's an awesome question because I think it looks a little different for everyone. But I would say it's passion and the commitment. The commitment is what gets the writing done, and the passion is what makes the writing good. So I think you don't need skill, you don't need experience, but you need to be willing to put the time in and put the effort in because it's something that you're excited about and that you're passionate about. And that ties into kind of my previous point of like figuring out what drives someone and why they're doing this, and then channeling that in. And really also trying to leverage that patient experience. So someone who is not will like not necessarily we don't want someone who wants to bear everything, but is willing to dive deep into their experience. And it doesn't necessarily even mean sharing personal details, but it means accessing that and using that to add that fire to what they're writing and add that experience because that's what makes, I think, young adult led pieces different than something that's just led by someone from the scientific or medical community. So yeah, the passion plus commitment create something really awesome. And I think Generation Patient, as Sneha says, the Generation Patient ecosystem is really fantastic at creating a community of people who have both those traits in spades. So every single person that we worked with throughout that had those traits, and it just made the job really easy and really fun for me because these folks are so amazing to work with, and I learned so much from them. So yeah, it was fabulous. Uh,
That's so cool. I just want to jump in and say that, like, uh, the, the way that I would answer that question has to do with fearlessness precisely because of what you just mentioned. The fact that everyone I've ever encountered at Generation Patient is just so incredible at what they do. And what they do being using their own lived experience to make positive change in the world. And that's a really intimidating thing to set off to do alongside them. And so, in my situation, our Catherine and I's roundtable was about clinical trials, and it it was really something I agreed to do on the basis of asking, well, what if these things I didn't like about this process were different? Like, what if what if instead of idly complaining about them to my family, I actually got off my butt and in a formal setting made the case for having things be different? And I think that in my circumstance and I would wager in other people's circumstances too, it was really about channeling that inner fearlessness of daring to be the person who suggests that things should be different. Because I feel like in our country we do have in some ways an incredible medical establishment and an incredible system that can deliver incredible healthcare. But in other ways, that system repeatedly fails everyone and especially young adult patients. And so I think drawing attention to that fact can at times be really intimidating. And so I'm just so grateful that a place like Generation Patient exists for us to find that community where we can sort of engage in it as a collective process, where no individual person has to stake it out alone and say these things in a vacuum. Um, it's through the roundtable process, it has just felt particularly effective, and I, as a patient, am really grateful that it exists.
Amazing. And I love your point about fearlessness, Rose. I think that is so important. Well, I want to leave the last few minutes because Rose and I could talk for the next 2 hours or more, but leave the last couple of minutes for question and answer, which I believe Sneha has put in the chat.
Oh, thank you all so much for that incredible conversation and really grateful. And before I unshare my screen and go to our Q&A for the last few minutes, I do just want to put this slide up. and really, really thank the Lucile Packard Foundation for Children's Health. As Rose mentioned, a core part of our work at Generation Patient and just values is making sure that our community is compensated for their time. We know that there's vast inequities in who gets to advocate, who gets to occupy spaces of leadership. And for us, compensation is essential. And we were able to do that through a grant that we received. And we have some incredible program officers, Allison Gray and Rebecca Cormack at uh, the Lucile Packard Foundation for Children's Health that have been truly so supportive and engaged to make sure that we have the support and resources we need to carry out these roundtables in a way that's authentic to the experiences of our community. And I just share this picture because we all had the opportunity to collectively meet at an event that we held in New York City in person a few months ago. So just a really supportive and awesome community and grant maker. So really grateful for that. So I'm going to go on to one of the questions that we have, which is so the first is for you, Catherine. How do you reach out to the editors and navigate the process of getting our community published in various journals?
Yeah, excellent question. So I first look for journals that tend to be focused on patient experience narratives. We are also trying to expand that out, but journals like Healthcare Transitions, journals like the Journal of Patient Experience have been really great homes for this work. And then I look to see if the journal has a specific patient narrative submission topic, and then I'll generally go there first. But even if we're not going to a journal that has that, I'll just outreach to the editor. We always like to outreach first, just so we have a little bit of an idea if this is something they're even interested in. I'll send the abstract to the editor and I'll also talk a little bit about the writing process, how we did this, how patients are involved in the writing, because I think that's a real asset to this type of work. And then I'll do a couple of sentences about Generation Patient. And that's been really helpful. And it's really great when an editor says, "Oh my gosh, that's fantastic. Like, send us your work." And then also, it's also really helpful when someone's like, "Thank you so much for your time, but that's not what we want." Then we're not wasting our time there. So that's what we do, but definitely sending the abstract to the journal editors and giving them a little bit of context about our process is usually how I get started.
I really appreciate that. And I think one thing is like Catherine has spent a lot of time doing that and like navigating the back and forth. So just want to appreciate that it does take time and um additional effort just to try to get these experience pieces published as well. So yeah, finding that. And then for Peyton and Rose, um one question that we have is these roundtable settings are with a variety of different stakeholders, and both of you have participated in them or have spoken at them. And so, from your experiences, what made these roundtables accessible for your participation, given that there's so many different layers of expertise and experience there. And just like what piece of advice would you have for people who may not be trying to do this roundtable model, but maybe trying to include more experiences in sort of a diverse array of expertise?
Yeah, I can hop in first. I would say one thing that made the roundtable super accessible was just, being able to be on camera, be off camera, like kind of participate in a way that felt like I could that day, because I have an energy limiting illnesses. So I think that was really, really helpful. And then also I would say that really like I feel like one thing that was kind of um said over and over to me was that like my lived experience is the most important thing. And so it can be really intimidating entering these spaces, kind of like Rose was saying earlier, with like people with all of these letters behind their names and people um who have been working in this space for much longer period of time. So I think um, just that rhetoric of, my lived experience is valuable and it's gonna inform this work, really just helped me feel like I was more able to speak up and like share my experience.
I totally agree on all those points, Peyton. And the only thing that I'd add is that for me, it was incredibly helpful to know that among the like in the audience of the roundtable, among the participants of the roundtable, I was not the only young adult patient. It's incredibly isolating and a vulnerable position to be in when you know that you're the only patient in the room, and it's a burden because you feel like you're speaking on behalf of this like gargantuan population that you cannot possibly fathom. Um, and you know, I want to celebrate the organizations that even have the one patient in the room, right? Like that's good. Please have one if the alternative is to have zero. Um, but all else being equal, it's so important to have a variety of patient perspectives represented, because otherwise, I feel as though you're putting an undue responsibility on the one patient in the room. And I know we've beaten the drum of patient compensation during this webinar, but just to beat it again, that it was so important that my time was compensated. And and not only was my time compensated, but it felt valued in the actual roundtable itself. I felt like I was taken seriously, even by it. It just so happened that in my roundtable, this wasn't the case for all of them, but in my roundtable, there were members of industry present, um, and a variety of other stakeholders, physicians, care providers, advocacy organizers, et cetera. But in that room, it really felt like I was taken seriously, even when at some times we substantively disagreed around the margins of particular issues. It was a surprise, honestly, the extent to which um, it I felt valued in that room.
Well, that's really awesome to hear. And I think there's so many lessons learned from our experiences just putting on these roundtables and things that we really loved and things that we would do differently if we were to do something like this again. I think there's no one right way to make sure that our community is at the forefront of identifying the challenges, identifying solutions. So really encourage everyone to sort of explore what that looks like. And we're here for any questions. We're going to have to unfortunately end this webinar. I think we would be able to talk about this for a lot longer than 1 hour, but you had our email, which is admin@generationpatient.org. We're very happy to chat about this roundtable series and make sure that your questions get to the right folks. But before we end, I really just do want to thank Rose and Peyton and in particular also Catherine for the incredible work that she's done for making sure that this process was designed in a way that can be adapted to each individual young adult patient author. It is a huge learning experience for us, and I think a hugely exciting moment because it is possible and it is an area that we feel like we want to contribute to growing even more, to have experience centered within areas of scholarship where traditionally it hasn't been. So with that being said, I'm going to end this webinar. We will have the recording and the slides available to all participants, but thank you all so much for coming, for your time, and for listening to us. And I hope you have an amazing rest of your day.